Well, it's a pleasure to have Eileen back. I think we've had her multiple times. Eileen is a longtime friend, and it's wonderful to have her back. Okay, so let's start with questions. Actually, we cut questions short for past 2 weeks. So I want to sort of bring all that back. In terms of updates, I have a couple of things. So feel free to go ahead and start putting the questions in the chat or any other comments or issues. So update number one, the study came out last week saying that 45% of Americans gained a significant amount of weight since the pandemic started. So I just want to point that out, that I think we're all, and I'm pretty sure that significant proportion of that is not just the fact that we're all stuck in the houses. The study has unfortunately missed what I think is a massive opportunity to say that one of the largest aspects of gain weight and negative impact of that on our health is actually a stress. So we've been trying in this group to give each other support and keep practicing. But I just, I don't have any specific suggestions. I'm not actually giving the wellness talk today. I'm simply saying this is an issue that I think we all need to be more aware of. But I will tell you a little bit about sort of my own background for the past couple of months. So I definitely under-recognized the total amount of stress that I've been carrying. And I think the result was more the twofold. So there's kind of a mild increase in aching throughout in the places that just my usual, like upper neck, for example, or some parts of the legs when I sit for too long. I think the bigger issue was I just realized that I was moving way less. And that's with my awareness with a trackable device, which I do have on myself at all the time. So it was basically a conscious decision of not doing the typical amount of exercise I was doing before. And, I was giving myself all kinds of excuses, more work, more this, more that. And the reality is, I think that's actually simply was a kind of a level of slight drop in energy that would prevent from going out or not out, or just doing things in the house. So it's an acknowledgement point, and more importantly, I think it's also an opportunity to kind of have a community chat about this, because I think what I found personally was most beneficial is simply just having other friends and saying, look, let's go for a run, or literally on purpose setting up something where I felt like I had to do it just because we're all doing it together, or we said to each other and now we're committed. So I think this is where community is important to say, how do we maintain the involvement, or more importantly, how do we maintain this kind of let's do it attitude? Because it's very easy to slip backwards, especially when you read all these things and you're bombarded by constant messaging. And then on top of that, it's not that easy to go out of the house. You have to put the mask on, you have to do all these other things. So again, put stuff in the chat, raise your hand. Does everybody know how to raise the hand, by the way? You know how to do that? So if you click on the side of your, reaction. So if you look on the screen, it says the reaction, so raise the hand. So when you raise the hand, then we see that. And so like Michael is raising a hand. Let me take a look at the chat.
Dr. Kogan.
Yeah.
Yeah, I have an important COVID timely question here. I was scheduled to receive a COVID shot today at 3 o'clock actually. But the problem is that I didn't get any sleep last night. It's very rare for me not to sleep at all. And I got that probably because of the stress of, getting a vaccination and other stuff related to work. So my question is, I've read a lot that if you don't get proper sleep, that can affect the immune response that the vaccine gives you. And also the side effects could probably be worse. This would be the first dose. Do you think the fact that I didn't get enough sleep is a big deal in this case, or should I just go and
Yeah, I don't think so. Just go for it. If impact on the immune system are immediate, but they're not profound for a short period of time. So when you stop, like let's say you miss sleep of one night, if it's not a chronic pattern for past many weeks, I think that negative impact is so light, relatively speaking, that I don't think there's going to be an issue.
So you don't think it's going to dampen the immune response at all?
No, because it's a different type of down regulation. And in order for the immune system to be down regulated substantially, you have to go through a pretty significant extended period of time of not sleeping. So I wouldn't worry as much.
And you also don't think the side effects are going to be worse because of the lack of sleep?
That actually is a great question. I'm not sure I can answer it well.
If I can chime in.
Great.
If I could chime in, I got my second dose on Tuesday. I too didn't get a whole lot of sleep this week for other reasons. I actually thought that it wasn't that bad. The second dose, they say, is worse than the first one. And the only difference that I really had was that I was achy. And in the first dose, I wasn't achy. Actually, the arm pain, while it was lingering this time, it was nothing compared to the first dose. So I would say that the lack of sleep didn't really have that much of an impact.
Okay, well, thank you. I appreciate your input, Benita, and also Dr. Kogan. I guess I'll go for it then. I guess I'll go for my 3 o'clock vaccination and cross my fingers. Maybe the second one is the one where I hope to get better sleep.
Just hydrate.
Okay. All right, thank you. Appreciate it.
I'm multitasking. There were some other questions. So, okay, that's fine. So if we go into questions, that's great. But if anybody wants to drop in and sort of weigh in on this whole issue of how we stay active, more of a communal discussion, go for it. But before we do that, let me just do one. Salome, I see your hand. Just keep it there. So one other real quick thing. So those of you who are keeping a very close track of what I'm saying may have remembered that 3 weeks ago I said that Johnson & Johnson was about 75% effective. So the newer study says that actually the Johnson & Johnson vaccine to prevent deaths and the severe complications, meaning requiring ICU, that is 100%. So that's a good news. Now it's still, I think, 75% effective at preventing any disease at all, but frankly, okay, so the whole point here is to prevent severity, right? So that's just an update and correction, I guess, because I may have said that it was 75% prevention of severe, but that was incorrect.
And
okay.
Also, Misha, isn't anything that's above 50% efficacy like great?
Janet, you're putting a practical spin on this, right?
I'm trying.
Okay, so what Janet is pointing out is that she knows that I'm extremely critical of a flu vaccine, not necessarily because I think it's a horrible idea, but because in the past many years, flu vaccine practical efficacy was continuously less than 50%. So it's basically a flip of a coin. And somehow idea that you can use vaccine at mass that has very low protection is something critically important to me never set well, because it's like, okay, well, it's a tool, but if that's the only tool, it seems to be quite crazy, and we should be doing other things like improving nutrition, decreasing stress, and better nutrients, but that always falls out of the radar for the standard of care. Anyway, so that's what Janet means. Yeah, so anything more than, actually, I think, Janet, for the COVID, they're set the target for every vaccine, the feds, at 70%. I just remember that number. Why, I don't know, and I may be a little off, but somehow I remember that all of the studies that were set to have a target mark was set for 70%. So far, of course, all 3 vaccines we have had surpassed that clearly. So, all right, but let's have Salome, since she raised hand first, and then we'll go to questions. Salome, do you want to unmute yourself? And
yes, yes, I did. Well, I didn't gain weight, I don't think so, but my brain was not functioning really well, I think, because I was not concentrating on certain things that I needed to do or should have been done, because I was just concentrating on how to avoid COVID. So all of a sudden, by October, I realized, oh my goodness, this should not happen this way, this should not happen that way, or I didn't do this. So that's really what I'm realizing now. So I had to go back and do certain things that should have been done like in May or something. We'll talk about it, but that's okay.
This realization, do you think it's helped you, and were you able to catch up, so to speak?
Yes, I did. But it was like a revelation to me. Like, how come I didn't think about this when all of a sudden now I'm like, oh, you know, I totally forgot about that. So I don't know. It was my brain thingy rather than gaining weight. So I don't know what that means, but okay.
All right, and then let's go to Kathy next, and then we'll do written questions. Kathy, do you want to unmute yourself?
Thanks. First of all, I share your COVID brain issue. I mean, we do all experience that, I think. But I wanted to ask you about the exercise issue. I have the two, you know, I'm fully vaccinated and everything, but I still have been reluctant to go to the YMCA and work out there. Do you have any thoughts on that?
Yeah, I hear you. And that's actually part of the reason why I wanted to bring this up, because I want us to go into this more practical aspect of conversation. So I'm actually exactly sharing this with you. I will not right now go to the gym facilities. And there are two reasons for them. So A, I still have my kids unvaccinated, even though my parents-in-law are supposed to get vaccinated, they haven't yet. And in fact, probably shouldn't say that, we're on a recording, oh the hell. My mother-in-law read something about from Russian news site that the COVID vaccine kills, and now she's adamantly refusing it. So, and I just gave up. I just said, I can only do what I can, right? And if she's this way, well, but that means that I have to stay way more vigilant, right? Because I don't want to be a transmitting to somebody else, even though I'm protected. So, and you know, the gyms are one of the areas where the risk is much higher because people are very intensely breathing. So mask or no mask, you would hope everybody would wear a mask in a gym, but still, so this is one place where I think, even if you're vaccinated, I think you should still be very, very cautious with the gyms. Now, I am, of course, always been somewhat critical of regular exercises, machines, and all that. So, but bottom line, make your own home gym. That's all I can really tell you. I'm sorry, I'm pretty clear here. I think eating out in restaurants, picking restaurants that are following CDC guidelines or being more outside, especially now that it's getting warmer, I think it's actually easier and more doable. And also, you know, like going out to a restaurant, we can't substitute that, right? There's no way to easy have that experience elsewhere. I mean, we can modify it to some degree, but it's limited. Gym, on the other hand, I mean, unless you, Kathy, tell me that there is something super specific about, not that I have anything against YMCA, we were members before COVID, by the way. But I don't really, the swimming pool would be one place potentially where it's kind of, if you're a swimmer, you really need access to that. But there are outside pools.
Yeah, there's an outside pool.
Yeah. So if it's an outside pool you're going to, you know, you're just passing through the gym, sure. Why not? I mean,
they've put restrictions on the use of the locker rooms, et cetera. So it's mostly for using for weightlifting and that kind of thing.
Yeah, but like, you know, they can say that, and of course you can, the locker room, it's controlled, more controlled environment. I mean, you're going in and out, right? I mean, you're not there for half.
Not you being.
Right. And but once you're in that common area, you know, and if you're, especially if you're, say, on a treadmill, and even if they skip some treadmills, you know, like where they separate them, most of those places, ventilation is still a little bit of an issue. Now, there are some gyms that I've seen and heard about where they make such a specific attempts. They either would filter the air or they put this large fence and keep everything open, etc. I mean, those are like, there are some specialty gyms that I think are designed for very specific purposes, for like very, you know, certain types of activities. And But generally speaking, most, especially YMCA, I would say probably majority of them are not designed to keeping all those measures and specifically thinking through that. So as an average, I'd say I'd be very careful.
Okay, that's helpful. Thank you.
That's a great question. All right. Updates and just going from the top. So any local hospitals using nitric oxide treatment for virus? Elisa, I'm not aware. And I think that I've heard about this method. I think so. So what Elisa is asking, so nitric oxide is a vasodilator, and idea here is that it actually, there's some data on enhancement of immune system and being as an actual treatment. I have not seen an actual data, even the randomized data of this. I've heard about this method, but I don't know a whole lot. It's sort of like there are all these side treatments that coming up. Venlafaxine is a good one, the antidepressant that had a JAMA article back at the end of last year. The problem is that there could be a small study saying there could be benefit, but then you don't have any follow-ups of this. So like, that's a great example of venlafaxine never actually got confirmed that it's an effective treatment. We had one positive study. Does it mean that it's effective? You gotta use all that data with caution. So, all right, Kathy is asking, it was on the news that vaccines are valid for 6 months. Okay, all right, that's a great question, Kathy. Thank you so much for bringing it up. So it's at minimum 6 months. So what we know for sure that at 6 months it's still 80 to 90% effective. Does that protection begins to win out after 6 months is yet to be determined. My gut feeling goes like this. The vaccine on average is going to be way more than 6 months effective. I predict it'll be at least 12 months for average person. The problem is not that. The problem is, will the vaccine be effective against new and upcoming variants? And I think that is TBD. From at least what it seems like that the current variant, which of course is now more than 50% of all current infections, the UK variant, the B117, I think. That still seems to be effective, the current all three vaccines. Will that change to the other variants? I don't think anybody can. It's all estimated guesses. Until we actually see the data, we're going to all be guessing. But I think the 6 months is a good number because it gives us a real sense of, okay, for 6 months, we all, like 99% of people who got the vaccine or whatever that actual number is, we're going to be protected. Great question. Okay. They're investigating J&J for similar possible blood clotting as AstraZeneca. Correct. There have been a few cases, not really clear whether those cases are actual because of the vaccine or it's simply statistical variations of vaccine associated with the given patient being triggering some other illness, which of course is always a possibility of a concern. I don't think we can really discuss this in way more detail beyond to say that it's a possible risk. It seems to be pretty unusual. But think of it this way. The disease itself clearly carries a dramatic increase in the clotting risk. And the clotting is one of those issues that if patient with a COVID presenting to the hospital, so meaning sick enough, and develops the clotting, those patients have way higher mortality rate. I mean, incomparably higher. Standard protocols for all the treatment right now that everybody gets put onto anticoagulants the moment they hit the hospital. That's just the standard of care at this point. And that's because of that, because we don't have a predictive tool to say this patient is going to get a clot, this will not. So everybody gets put on that protocol. I have not heard any discussion about being cautious about this. Like, for example, you could arguably say, should I be taking aspirin after the vaccine for a week? All the consensus saying absolutely not, because that risk seemingly so small that if you're trying to take any anticoagulants, you're probably going to assume way higher risk from that treatment. So, but it's a great question. Thanks, Rick. Oh, and the timing of a clotting, no, it's actually sooner than 4 to 5 weeks. It's that dysregulation of clotting occurs within probably 7 to 10 days. So I would put that risk at 1 to 2 weeks after the vaccine, if it's any. Linda asked me a private question, but I'll make it public because I think it's a really important question. Is there a way to test allergy for PEG and polysorbate 80? Okay, yes, you can theoretically do a skin prick. My understanding, and we actually had this whole discussion in the grand rounds last week, that only if the patient has a very significant history of this reaction should that patient be tested. There's 2 reasons why. A, it's a convoluted test. It's not something pretty simple. A lot of allergy and immunology clinics do not offer this test. It's just not standard of practice. My understanding that there's several universities are aggressively trying to develop the test to be uniform. But current GW process is going to be, unless the patient has documented PEG or polysorbate 80 allergy, they're not going to be offered that, especially since the risk, general risk, seems to be about 2.5 cases per million, and nobody died. So they just had the severe allergic reactions at that rate. So it's a pretty low rate. So imagine if anybody says, look, I want to go get tested, and the problem is also test is not just complicated, it's also could potentially be risky. So you basically put in, because there's amount of PEG and polysorbate in the vaccine is very small. So relatively speaking, your test of allergy will be almost as dangerous in that sense as the vaccine administration itself. So of course they can do titration, dilution, but there's still a risk involved, even with the test. So, all right, 3 more minutes.
Can I interrupt for a sec?
Sure.
We have a question. I have my first vaccine shot next week. I have a colonoscopy and endoscopy on May 18th. Should I be aware of any possible things that may impact these exams?
So let me see. So it was the vaccine next week. So we still no, this is more than 2 weeks apart. I wouldn't worry.
Okay.
Or wait, or is that a first shot? And then there's a second one.
Okay, so the person who sent me this question, do you want to ask your question directly to Dr. Kogan?
Sure, I can ask it. Can you hear me?
Yeah.
Yes, I have my first COVID shot on Tuesday next week, but I have a mammogram. I have a endoscopy and colonoscopy scheduled for May 18th. So due to the timing, I was wondering, I know with the mammograms, they had issues with the lymph nodes and they were recommending you wait 4 weeks because of that. Is it similar with colonoscopy and endoscopies as well, that something may show up?
So for all the non-urgent or non-clinically needed timing procedures, like just basic screening, I would say at minimum 2 weeks apart. Because if you get the first vaccine next, you're getting Pfizer or Moderna, right? You're not getting Johnson & Johnson?
I'm hoping that's Pfizer next week.
Okay, so that means that you're going to be, your second shot is going to come right before, right around the same time of the colonoscopy.
Right, it may be 2 weeks possibly if they have the scheduling on time.
Okay, if it's 2 weeks, if it's cutting it close, but if it's 2 weeks, I would say that's fine for colonoscopy. For mammogram, they want 4 weeks. Practically, I tell to patients probably 2 weeks is okay, because even if you do have lymph node swelling, it'll go away in 2 weeks. They just want to make absolute certainty. And it's also, if you're talking about non-urgent screening test, giving a couple of weeks apart, you just reschedule. I'd say this: if it's easy to reschedule 4 weeks later, just do it. And so this way you won't even need to think about it.
Okay, that's what I was wondering, particularly with the endoscopy more so than the colonoscopy, I was thinking.
So wait, endoscopy is never screening. So they're looking for a symptom? You have something going on?
I just had upset stomach. They think it's just stress from the past year, but I've done CT scans, MRIs and everything. So this was just my regular scheduling. And the endoscopy was optional, but they just said for peace of mind, doing both might be preferred.
I'd be careful too.
It was more reflux than anything.
Well, I would, if that's the case, because that's no longer screening. You may want to talk to the gastroenterologist quickly before I tell you that, because if they're looking for something specific, there may be a reason why they want it now.
Oh, no, it was me picking the date. It was just, it wasn't urgent or anything.
Now, in that case, in that case, I would just push it out. I mean, I think if there's no real risk of any, they just wanted to check something, then I'd push it out.
Okay, thank you very much. I appreciate it.
So, Eileen, it's right to 30. So do you want to just have a couple more questions? I see Irene has hands up.
You could spend the whole hour doing questions. So it's really up to you.
No. It's come on. We don't
I mean, I have 3 short practices that I'd like to share if I got through.
Okay, how about this? I'll take Kathy's questions, Irene's question. I'll keep each answer short. And I don't see anything else in the chat unless I missed something. I addressed Linda's question. I don't see anything. Oh, there is something else there. I don't know the answer. Kathy, I don't know the answer to this question with this FDA form.
I'll give up my question and let someone else go.
Okay. Okay, so Irene, go ahead and unmute yourself.
Okay, I just wanted to support what you were saying about the working out and all. I had a very rough year with putting off, and I have worked out my whole entire life. I have belts in Taekwondo, so I'm not a sissy. But with the COVID, the depression and everything got to me, and I'm trying to get back to it. My husband put up a home gym. It cost him about $1,200 with the weights and everything, and a Smith machine. It's not impossible. And our pool that I have access, rather, will let you go in and swim, but you will have to walk out wet into your car. They don't let you use the facilities for changing. So those are the things that I wanted to say. And just to say, I was there also with the exercise going awry.
Thank you.
Thank you.
Thank you. Thank you. Okay, so then I'll do Elizabeth questions and a question about the gardens and nurseries, and then I guess that's it. Oh, and then the Diana's question would be last. Okay, is it okay to go public gardens, national parks, farm? Okay, so those are all outdoors. Yeah, I mean, I think that's where, in fact, when I'm outdoors now, unless I'm close to someone who's not vaccinated and have concern about them, I don't wear a mask. If I on a narrow trail and a person coming up to me, if I see them wearing a mask, I do one of 2 things. I either put the mask on because I have it usually right on the neck or something, or I simply move away from the trail at least 10 feet away. That's what I do. But, and that would apply to anything. Now, of course, some of the public gardens could be quite crowded, but generally speaking, I'd say that's just my take. I stop wearing masks outdoors unless the people are really close to me, somebody who I don't know. So, all right. And then the last related allergy question. I met with an immunologist last week because of a non-severe but immediate reaction to first Pfizer vaccine. She did not recommend testing for PEG because of the complicating factors and the results may not be reliable. That's exactly what the grand rounds that we had. We have a presenter who said exactly that the tests are not very good. And so running the test is not going to necessarily change the management. And PEG may not because of the reaction. That's absolutely correct. So the only current way that the immunologist would sort of decide to test if there is absolute certainty of a history of a PEG allergy, and then they would do it to decide. But now they're also saying, well, if you're also starting to see other vaccines that are not going to contain a PEG, then what's the point? So I'm just saying this whole issue with the PEG and polysorbate 80 is kind of becoming not the most essential one, but it's a good thing to discuss. And with that, thank everybody for questions. Sorry about the background noise. I hope it wasn't too disturbing. And with that, I'm so excited to follow Eileen. And I will tell you one thing, that I will have to leave 2 or 3 minutes before 3. I have another meeting. So let's end pretty on time. Eileen, can we end at like maybe 2:55? Is that okay?
I mean, 12:55 here. Yes.
12:55.
Okay, I'll talk.
Mountain time.
Yeah, I'll talk fast. Okay. So, you know, it seemed to me with ourselves and also with our friends that when it became the anniversary of the 1 year of the lockdown, everybody got worse. It was like all of a sudden it hit you. How long? We have this beautiful tree outside our kitchen and it's leafing again. And it's like, wow, I mean, I was home, stuck in the house when it did this last year, and here it's doing it again. So anxiety has really been a big thing for many people. What I thought I would do today, if I can get through them, is I have 3 short practices, and you will have them available in writing to go over again. So let's just get started and do them. The first one is a practice to help us fully experience the present moment. And you know, it's interesting, mindfulness tells you you need to train your mind, you need to build skills and get somewhere. Then on the other hand, it says, accept yourself the way you are, love yourself, give yourself compassion. We are enough. We have everything we have is okay. There are 2 conflicting ideas. They're really not conflicting. They're really not. And this is a very good practice to help us just be right in the present and not try to change things. So get comfy. If your feet are crossed, please uncross them and rest your arms, not holding them like this. Put them on the arms of a chair or on your lap or on the furniture. And we can start by embodying our intention for the practice in the way we hold our body. So you can think, I intend to do nothing in this practice, but with a sense of presence, awareness, and relaxation. So sit with your back straight or lie down. And let's start by taking 2 breaths to let go of whatever came before this practice and whatever will come later. You can close your eyes or you can keep them open and focus your gaze. I think it's better if you close your eyes, but some people don't like doing that. So take 2 breaths and let yourself relax as you breathe out. Okay, now let go of any kind of intention to change anything about what you're experiencing in the moment. Drop the resistance, just let it happen. Now, if you find yourself focusing on another practice that you do, paying attention to your breath or sounds or saying a mantra or an affirmation, let that be part of the state of what you're experiencing now. Let go of any intention to change anything. Now, you may also notice yourself feeling uncomfortable. Maybe you're tired, drowsy, getting bored already. Maybe your thoughts are about all of your challenges and stresses. Whatever it is you're noticing, in this practice, there's no need to fight any of it. Just let it happen and acknowledge what's going on. It's a radical act of self-acceptance. Maybe you notice some external experience like noises or people talking. Accept it as part of your meditation experience in this moment. This is exactly what it's like to be you in this moment. All we're doing here is dropping resistance and accepting completely, just to see what happens. So bring a sense of curiosity. What happens when you fully do nothing and let things just be as they are? Now, often when we're trying to take a break, the idea of taking a break can be pretty effortful. We can find ourselves trying really hard to relax and trying hard to stop thinking and to enjoy something. Is that really a break? In this practice, we're not trying to do anything. Maybe you're thinking, well, what happens when you just let that happen? Just be aware of it. Maybe you're not enjoying this meditation or you find yourself confused. You can just let it happen. Now, sometimes our self-care routine, whether it's exercise or mindfulness or something else, sometimes the routine becomes like an entry on our to-do list something that we're trying to check off in our already overwhelmed lives. And that can be useful, but sometimes it can take over, and you can lose track of being present without trying to change things. So let's refresh our intention. Just start again. Spend this time for the next minute not attempting to change anything about what we're experiencing. And anything that you experience is okay, exactly the way it is. And I'm going to count the minute. Okay. Now take this last moment to let go of the practice. See if you can carry forward whatever insight you discovered into whatever comes next in your day. And it's a sense of balancing between striving to be better, to help yourself, to help others, to take care of yourself, to get that task done, balancing that with the sense of just being okay with the way things are. Especially in challenging situations, this can be very hard. So I would suggest just try this a few times at different times when you're feeling okay or when you're feeling not okay. Just accept what is. Even if you wish you could control something and you can't. That's the way it is. And life is constantly changing. Okay, so just sit quietly now. Take a deep breath. Breathe out. If you've closed your eyes, slowly open them, come back here, and sit quietly. Okay. Now the next practice I'd like to do with you is a quick body scan to calm things down. And this is if you're anxious, and it sounds like many of us are anxious some of the time, you often not only feel it in your mind, but you also feel it in your body. And sometimes it's not clear whether, let's say, muscle tension or your heart beating fast or your rapid breathing, if that's due to anxiety or something else. So this is a short body scan, and you can modify it. We're going to have to do it fast because of time, but you can take your time doing it more slowly if you like. And so we, again, start by finding a comfortable position. They say standing, sitting, or lying down. I don't think standing is the way to do this, but some people like to. Let your eyes close if that's comfortable, and take a few slow, deep breaths and allow your body to relax as you extend your out breath. We're going to focus on 4 different areas with the acronym CALM, C-A-L-M, chest, arms, legs, and mouth. We'll start with C for chest. So bring your awareness to your chest and torso. First, scan your chest, opening and lifting it, creating enough room for your lungs and belly to fully expand, and bring your awareness to any sensations there. Is your breath shallow and short, slow and even? As you regulate your breath, you regulate your body and your brain, and in turn, your emotions and your impulses and your attention. Is your heart beating fast or slow? Is there any tightness or tension in your chest? Just notice. Allow your breath to expand your chest, releasing any tension there. And now, tense all the muscles throughout your chest and torso. Tighten up and hold them for the count of 3 as you notice what the tension feels like. Stiffen up. And now, allow your muscles to relax. Let yourself flop and feel the tension flow away and relaxation flow in with the next few breaths. Okay, now we're moving into the A of calm, to your arms. Shift your awareness now into your arms from your shoulders down to your fingers. Lift and drop your shoulders once. Shrug your shoulders up, drop them, and let your arms fall to your sides or into your lap. Now scan your awareness upward from your hands through your forearms and upper arms. Just scan and notice what it feels like. Are your arms shaking or still? If they are shaking, can you just let them settle? Are they tensed partly into fists? If so, release that tension. Scan up your arms to your shoulders and notice any other sensations that might give you a clue as to your emotional state. Sometimes people hold a lot of tension in their shoulders and upper arms. So lastly, squeeze your fists, make a fist, tense your arms all the way up to your shoulders and hold for the count of 3, feeling the tension. And now relax. Release the physical and emotional tension. Let your arms relax completely. And take 2 more breaths. Okay, moving on to the L, which is legs. Direct your attention down to your legs from your hips down through your toes, allowing your attention and your breath to flow through your thighs, your calves, and your feet. Often our legs can be shaking with anxiety or holding tension and stress by being tight. So let your legs become still if they are moving and relax them. They may feel heavy on your chair, and that's okay. Now gently begin to squeeze the muscles in your feet up through your calves, your thighs, and up to your waist. Hold that tension for the count of 3, noticing the sensations. And now release. Let your body flop from the waist down and take 2 breaths. Feel the tension flowing out of your legs. And lastly, we're going to the M of calm, which is your mouth. Many people hold tension in their mouths and jaws and clench their muscles without even being aware of it. So what expression is your mouth communicating? Stress, anxiety, anger? Notice this and any other sensations in your mouth and also in the rest of your head and neck. Now clench your mouth and other muscles around it, holding for the count of 3. And now release. Let your mouth flop open if it wants to. Allow it to relax, your mouth, that is, to relax into a small smile to yourself and to the world around you. Take a moment to just enjoy the sensation of relaxing and smiling. And it's been studied. If you smile, then your brainwaves change. So that, you know the expression, fake it until you make it? If you make a fake smile, it will actually change things and make it easier for you to really feel happy. So now, just as we come to the end of this one, just reflect on where in your body you tend to hold emotions and tension. And before we finish, breathe into those areas and just let them relax. You can do this practice any time of day. It's quick, or you can draw it out and spend a few minutes in each area. But it's very nice to just sort of tune in, especially if you're the kind of person who's holding tension without being consciously aware of it. Okay, one last breath into whatever area you're tense in. And now, just sit quietly. Children like to do body scans, by the way. So if you interact with kids, either in your family or at work or friends or whatever, and you want to do a little game with them, especially if they look uptight, this is a fun thing to do. Okay, and now the last one is called 8 breaths to joy. And this can be done in as little as 8 breaths. I hope we'll have a time to do like 30 seconds for each one, so it'll be more than 1 breath per item. And each breath has a single word to help you how to focus your attention, help you remember how to focus your attention. Okay, so with the first breath, bring your awareness to your breathing. Pay attention to the physical sensation of your breath as it moves in and out. Follow your in-breath and out-breath from the beginning to the end, and say to yourself the word breath. With the second breath, bring your attention to all of the sensations in your entire body. Notice what you find. Some sensations are pleasant, some may be unpleasant, some may be neutral. Just feel them without trying to change them at all. And pay a special attention to any tension or heaviness or agitation. And as you do that, think the word body. With the third breath, actively release all of the tension, heaviness, and agitation in your body. And you can imagine that it's being washed out of you with your out breath. And as you do that, the word is release. Just relax as you breathe out. With the fourth breath, say to yourself, may you have ease and lightness of body and mind. Say it with your heart filled with love and generosity toward yourself. You're wishing yourself well and sending compassion to your body and mind. So as you breathe, think, may you have ease and lightness of body and mind, and the word is love. With the fifth breath, notice if there are any cravings or aversions present in you. Is there any part of you that wants reality to be different than it is right now? Are you fighting against things as they are? Just notice any cravings or aversions. Let yourself feel them without trying to make them go away. They're not your enemy. They're a part of you that needs love and caring. And the word for this breath is cravings. I bet everybody has at least one thing that they'd like to be different. With the sixth breath, become aware that everything you need to be happy is already present in this moment. What matters is where you're putting your attention. So don't ignore the positive things. Problems do exist, but they're not all that exist. So for this one breath, focus on everything in life that's good. Don't regret the past. Don't worry about the future. You're here, present to the miracles of life. And the word for this breath is letting go. With the seventh breath, become aware that you're alive. As you breathe, feel the energy of life moving through you. Being alive really is a miracle. Be fully awake to being alive in the present moment, and you see how precious life is. The word for this breath, alive. Why are we here at all? Why does anything exist in the universe? It really is a miracle. And with the final breath, become aware of all the beauty within and around you. When you let go of your own desires and become waking up actually to the present moment, you see that reality itself is very, very beautiful. And all of your senses, sight, sound, smell, taste, touch, and mental perception, all of your senses deliver this beauty to you like a precious gift. Just enjoy it. The word for this breath is beauty, within and around you. Okay, that's the practice. So I will ask you to try it once, doing it just in 8 breaths, and there's a list of what you concentrate on in the handout. And then also, if you like the practice, try it a little bit more slowly. And you feel that you sort of start from a normal sort of place, and you end up experiencing, it's great to be alive, and there really is a lot of beauty. So enjoy. Thank you for doing this. And your handouts will be available for you.
Thank you, Eileen, so much. Oh, it's always so wonderful to break away from running here and then just drop down and breathe. So I have to leave in literally a minute or two. I think there's an announcement.
Yes.
Right, Janet? So why don't we just hold off the questions until next time and do the announcements?
So next week, I'll be turning things over to Tatiana Zanyenko-Miller, who you all might remember. Tati was with us a couple of weeks ago to do the mind-body practice. And I'll still be on the video, but I won't be running the meeting. So it's been an honor and a privilege to meet all of you, and thank you for being one of my weekly social interactions. Oh, thank you. Okay, Misha, go for the questions, or the one question.
And did we, sorry, I had to take this phone call. So are we, so next week is a song symposium.
Oh,
Friday.
yeah.
So we're not gonna.
No, Misha. Sung Symposium
is following week. Sorry,
following week.
2 weeks from now.
Yeah.
So just everybody, just 2 words on that before we break. If you haven't registered, please do so. You can find registration on YMH website. And why don't we put the link also into the email that we'll send?
Yes, I'll do that.
Today's. So. And well, thank you, Janet. She's not going anywhere. We just she's gonna be here with us, so it's all good.
Thank you, everyone.
We're very honored to have Tati step up and help out, and we'll see you all next Friday. Enjoy the magnificent weather, by the way. Bye.
Thanks. Bye.